Hello, fellow hair loss sufferers, YouTube surfers, and online posters. Dr. Alan Fellow here. I just came back from a long day at the office, but I did want to get in a quick video about shock loss. Shock loss basically means the loss of hair, be it temporary or permanent, from the recipient area due directly to the trauma experienced by a hair transplant. Put another way, if you already have hair here when you go in for a hair transplant, and transplants are placed within that hair area, those hairs may fall out either temporarily or they may even fall out permanently. Now the reason for this is probably the disruption of the blood supply in the area. When a hair transplant is performed, little incisions are made, be it with a needle or a slit blade or whatever. These little incisions are going to cut the blood supply a little bit. But nowadays, with especially mega sessions and dense packs, even a little hole multiplied hundreds if not thousands of times can result in a lot of vascular compromise, which can cause the native hairs that are already there to fall out or respond negatively to the hair transplant. Now fortunately, in most cases where I've seen shock loss, it was temporary. It could take 6 months, it could take a year and 6 months, and the hair will usually come back. But in some cases, the hair may not come back. That's the worst kind of shock loss. So when I'm evaluating a patient during consultation, I will look at an area, and if it looks significantly thick and very prone to permanent shock loss, I will decide not to transplant into that area, but rather around it. And a great example is if you look online, I do what I call mohawk busting, where you see patients where they have that kind of mohawk in the middle here, but they've lost the sides here and here. And what I'll typically do with these patients, if the mohawk is still relatively thick, is I will not fill into the mohawk area. Instead, I'll take those grafts and I'll wrap it around and in front of the mohawk, so that I'm not going into the mohawk area, but rather just working above the forehead. And the reason this works so well is because a main portion of the blood supply comes up right from here, and it feeds the whole front part of the scalp. There's another blood supply on either side here called the temporal arteries that will supply this side of the head, and then there's occipital arteries that do the back. So the scalp is very well vascularized, particularly in the front, because there's no competition here. There's no hair growing on the forehead. So all of this blood supply can be used to feed this front section. That's why dense packing works so well, especially on a hairline, because this whole area here is so well vascularized and it has no competition from hair on the forehead. So you'll see a lot of my patients when I'm doing these mohawk busters, you'll never see any shock loss in the actual area of the mohawk, because I didn't work in there. However, if a patient is significantly thin enough in the mohawk area, and that does happen, especially as you get older, I will actually shave down the mohawk area and I will carefully go in between the hairs. I may use a slightly lower density so as to decrease the chance of shock loss. But it's a bit of a balancing act to avoid shock loss. But let's say someone's really thick here but has nothing on the sides, and you've all seen someone like this in the office or at a club or something, or on television. Best thing to do is just work around it and avoid shock loss. So in short, shock loss can be permanent or it can be temporary. You really don't know. It depends how the body's going to respond. But analyzing the scalp beforehand, weighing the risks and benefits with your doctor first, you should be able to avoid shock loss almost 100%. I'll talk more about this in future videos, but just something I wanted to get out there because so many patients ask about it during consultation, and it is a significant issue. If you want to learn more about how I do hair transplants, just go to fellowmedical.com and check us out. We'll see you in the next video. Take care.